Good morning, students. So continuing with that of the rheumatoid arthritis. So in yesterday's video, I discussed regarding the immunosuppressants as well as the TNF blocking agents, that is tumor necrosis blocking agents. Okay, continuing with that of the drugs, the next class of drug is inhibitor of T cell activation. Inhibition of T cell activation. Okay, in this the drug is abatacept. The drug name is abatacept. Okay, so normally the name only indicates it inhibits the T cell activation. So when you give this abatacept, normally it inhibits the activation of the T cells, because T cells are normally required for the immune activity. Okay, so this drug is normally given by IV route. Okay, so especially in the form of infusion in the dosage of 800 to 1000 mg, which is repeated every 2 and 4 weeks, which is repeated every 2 and 4 weeks. Okay, so this drug has got long half-life. It is around 13 to 16 days. Okay, because of that you are giving either at 2 weeks or at 4 weeks. Okay, so when you give this drug normally shows the symptomatic improvement in patients with rheumatoid arthritis. Okay, so as such it doesn't have adverse effect. So if it shows the adverse effect, the most common is hypersensitivity reaction. If it occurs also, rarely it causes hypersensitivity reaction. Upper respiratory tract infection. Okay, because the T cells are avoided, because of that it might lead to upper respiratory tract infection. Okay, the next drug under the next class is Anakinra. So this Anakinra, it is a Interleukin 1 antagonist. It is Interleukin 1 antagonist. IL stands for interleukin. Okay, so what happens is when you give this drug binds to interleukin receptor. It binds to interleukin receptor, decreases the effect of interleukin. Decreases the effect of interleukin. Okay, so normally the persons who do not respond to other classes of drugs, like immunosuppressants, tumor necrosis factors, okay, so in such case this drug is most commonly used. The next class of drug is anti-B lymphocyte antibody. Anti-B lymphocyte antibody. Okay, example of this drug is rituximab. Okay, so this rituximab, it is normally obtained by monoclonal antibody. It's obtained by monoclonal antibody, which is effective against B cells. Is more effective against B cell. Okay, that means this normally decreases the number of B cells. So this decrease in the number of B cells in turn responsible for decreasing the inflammatory process. Okay, in addition to that, it also decreases cytokines, because cytokines is one of the mediator for inflammation. This is also reduced. Okay, so the drug, it is used mostly in the treatment of lymphoma, so especially cancer of lymph. Okay, and in case to moderate to severe rheumatoid arthritis. Moderate to severe arthritis along with methotrexate, used in combination with methotrexate. Okay, so this is one drug. The next class of drug is interleukin 6 Antagonist. Interleukin 6 antagonist. Antagonist means the agent normally blockates. Okay. Example of the drug is Tosalyzumab. Tosalyzumab. This is the example of the interleukin 6 antagonist. Name only indicates it blocks the release of interleukin 6. Okay, because again interleukin is responsible for the process of inflammation. Okay, so what happens is when this blockade of interleukin 1, it also decreases the T and B cells. It decreases T and B cells. Okay, so here as I told earlier, like interleukin 1, here also the drug binds to interleukin 6 receptor and blocks the action. Okay, so similar to that of rituximab, it is also used in case of moderate to severe rheumatoid arthritis along with methotrexate. Okay, so since it is reducing the immune activity, so the person will be more prone for infection. Okay, coming to the last class of drugs, the gold salts. Okay, so earlier the gold salts was most commonly used, but because of its toxicity and less safety, so gold salts are not used for the treatment of rheumatoid arthritis. Okay, so normally when you give gold salts usually suppress cell mediated immunity. It suppresses cell mediated immunity. Okay, so normally what happens, suppression of the cell mediated immunity normally decreases the sign and symptom of rheumatoid arthritis. Okay, common adverse effect associated with the drug is pigmentation of skin, hepatotoxicity, nephrotoxicity, neuritis, encephalitis, pulmonary fibrosis, and bone marrow depression. Okay, so this is regarding gold salts. Okay, so the next drug is Pencil Amine. These are the other drugs, not much used. Just give a brief this thing. So this Pencil Amine, it is a metabolite of penicillin. Okay, and normally it also acts as a chelating agent. Chelating is nothing but formation of complex. Okay, so this is also not used because of the toxicity similar to that of the gold salts. Okay, so this is regarding the various drugs that are used for the treatment of rheumatoid arthritis. Most common is NSAIDs and immunosuppressants. Okay, so this covers the third unit. Okay, so please don't keep it pending. Go through the syllabus, whatever is covered. Thank you.